6 months after Jodi underwent her LEAP procedure, she came back for repeat pap smear screening and HPV testing. Both of the tests were negative. Her prognosis is excellent.
It's going to work out fine and everything's going to be great now. And luckily I did have the test and I had the surgery to correct it, and I caught it early enough. So now we can move on with our lives.
I believe in Jodi's case, without the HPV, there certainly would have been a significant delay in her diagnosis.
Thank God that they did find it, because it would have been another whole year before, she would have gone for a regular pap test.
I would have never known about the cells, the virus. It would have just continued to grow, and then it would have been a huge issue down the road.
I suspect we would have picked up the precancerous condition of the cervix within the following year or two. Most of the time, precancerous conditions of the cervix will not advance to cancer that quickly. However, you can't be certain that that's the case.
It could have been that much more advanced and that much more of a serious treatment at that point in time, which would have affected our family tremendously, and just everything would have been escalated that much more.
We were able to pick it up much sooner by virtue of the fact that we did the HPV testing. The benefit to the patient there is that the lesion was more easily excised and probably more successfully treated.
So I was very grateful that there is an HPV test that goes along with the PAP now, and that I caught it very early, and I was able to just have minor procedure to rid me of the cells.
Jodi's case, I think, illustrates 2 points very well. The first is you cannot predict a woman's risk of cervical cancer or HPV positivity. You need to do the test. Secondly, the pap smear, though it's been a very good test, is not as sensitive as it could be. The HPV adds that degree of sensitivity, which has helped a lot of women, and particularly Jodi.